Hi, I'm Sheva Carr.
And I'm Robert Browning.
We work with HeartMath Healthcare, delivering HeartMath interventions to healthcare providers and their patients in hospital settings, bringing resilience in the face of challenge. And at HeartMath, we define resilience as the capacity to prepare for, recover from, and adapt in the face of challenge, adversity, or stress. The U.S. Navy adopted this definition of resilience based on our 30 years of peer-reviewed evidence-based research in the field of peak performance and stress management. And we definitely need resilience now in the healthcare world in the face of COVID-19 and the pandemic. Many of you watching this video are on the front lines of caring for. So today we want to talk a little bit about, we talked about the U.S. Navy adopting this form of this definition of resilience and these interventions to create more resilience. Because the military, and they coined this phrase VUCA, which is an acronym that stands for volatile, uncertain, chaotic and complex, and ambiguous environments, which describes a war zone. But I think many of us working in healthcare feel a little bit in the face of the COVID-19 pandemic like we are in a war zone fighting this invisible enemy. And the nature of that chaotic complexity that arises in a battlefield points us to some research that HeartMath has done and other stress management researchers, which may not feel true in the moment, but it's good news that it is true, that stress is not in the situation, it's not in the external circumstance. Stress, it's been discovered, is actually in our physiological response to the circumstance. And that physiology is something we can take charge of. So even if we're in a chaotic external circumstance like the COVID-19 pandemic, we can create order inside. So the heart rhythm patterns are the first thing to change physiologically in a stress response. When we're confronted with an external stressor like the coronavirus and all that it's demanding of us in healthcare, if we react with a stress response, it causes a chaotic pattern in the heart's rhythm that changes over 1,400 things in our physiology, just like in OBGYN or labor and delivery, where we're using fetal monitoring to look at heart rate variability and assessing changes in fetal heart rate to determine fetal distress and whether we need to do an emergency C-section. It turns out we can use that same marker to assess adult distress. But the news gets even better because it turns out as adults, we can self-regulate or learn to self-regulate our heart rhythm patterns to bring them out of that chaotic inner environment that produces chaos to over 1,400 physiological cascades in our body, and bring order to that heart rhythm pattern that has the same universal system-wide effect, making us nexus points of order in a crisis. Sometimes what I like to call pacemaker cells in the heart of humanity. So we're going to do a tool with you right now that helps bring that system-wide order inside in the face of chaos outside.
And the steps of these tools, and this particular tool, is so easy that you can apply it to yourself, whether it's in a personal dynamic with the stresses relative to home, whether it's actually in the field at work itself. It's so easy to pass on to distressed family members and patients that you see in distress who might not have any understanding that there's any way to create a more balanced shift inside. So we want to be able to share this to you in a way that not only benefits yourself, but also can benefit anyone that you care about or are in service to in the moment. So the 2 steps are this. Step 1, heart-focused breathing. Shift your attention to the area around the heart and imagine that your breath is flowing in and out of your heart or chest area a little deeper than usual. This is heart-focused breathing. It's not forced. You're just finding a rhythm that's comfortable for you. And step 2 is, while you maintain heart-focused breathing, just now make a sincere attempt to experience a certain sense of calm or ease or appreciation for something simple in your life, or compassion for what people are going through. Breathe any regenerative feeling that comes easy to you, and breathe that through the heart area.
As you breathe that regenerative feeling in through the heart and out through the heart. And it doesn't have to be something grandiose. It could be as simple as appreciating this photograph. I love sunflowers. Something simple that brings a self-soothing to your autonomic nervous system. You can do this while you're inserting an IV. You can do it while you're walking down the hall from one patient's room to another. It can be done in the midst of your response to the crisis. You got to breathe anyway. So breathing gratitude or compassion as you go puts your autonomic nervous system and those 1,400 physiological events in your body in a flow. And when you get in that flow, it also opens up the communication pathways to the higher centers of the brain, where we have more situational and self-awareness. This means that we will be more effective at using our PPE, our personal protective equipment. We'll be more self-aware as we do it for our own safety. We'll also be more situationally aware of our environment and what's needed for patient and colleague safety. But in addition, it opens up the foresight, visionary goal setting, and solution-seeking centers of the brain that allow us in that situational and self-awareness to make better decisions, to know what to do in a time of great ambiguity, uncertainty, and confusion. We're so grateful to you for being the heroes on the front lines of this uncertain and confused time, being willing to put yourselves in a place to be of service to all. We hope this tool has been of service to you, and if you'd like more support, you can reach out to us for private coaching or extra resources and information at destress, DESTRESS, at heartmath.com.